Do you frequently feel like your joints are so sore that even moving your fingers hurts? Or maybe you've had a sudden high fever with a rash and thought it was just the flu. If so, you might have heard of or even faced a disease called chikungunya. While it's not as commonly talked about as malaria or dengue, chikungunya is spreading in many warm countries, especially where mosquitoes thrive. The name chikungunya comes from a word meaning to become contorted, because people with this disease often bend over in pain from joint aches. It's not usually deadly, but it can make you feel terrible for days or even weeks. The good news, you can protect yourself, and scientists are working hard to stop it. So, what actually causes chikungunya? Think of it like getting hacked by a virus, but instead of a computer, it's your body, and the hacker is delivered by a tiny mosquito bite. The virus responsible is called the chikungunya virus, CHIKV, and it belongs to a group of viruses spread by insects. Two common types of mosquitoes, Aedes aegypti and Aedes albopictus, are the main carriers. These mosquitoes don't live in dirty water like some others. They breed in small containers like flower pots, old tires, or even bottle caps with rainwater. If a mosquito bites someone who has the virus, then bites you, you can get infected. It's like passing a bad cold in school, but through a mosquito instead of a cough. Imagine waking up with a sudden high fever over 102 degrees Fahrenheit, feeling shivery, and your joints, especially in your hands, feet, knees, and back, hurting so badly that you can't walk properly. That's chikungunya in action. You might also get a rash on your arms or chest, feel very tired, or have swollen joints. Some people even get stomach pain or nausea. These symptoms usually start 4 to 8 days after a mosquito bite, but sometimes up to 12 days. Now, here's an important point. These signs are very similar to dengue or Zika. So, if you're in a place where these diseases are common and you feel like this after a mosquito bite, it's time to see a doctor. Most people start feeling better in about a week, but for some, joint pain can last months, which can really affect daily life. How do doctors know it's chikungunya and not another illness? They can't just guess by looking at you. First, they'll ask about your symptoms and recent travel, especially if you've been to a tropical area. Then, they may take a blood sample to test for the virus or the antibodies your body made to fight it. This is like checking your phone's history to see which app caused a crash. There's no special medicine to kill the virus yet. So treatment focuses on helping you feel better, rest, drink lots of fluids like water or coconut water, and use medicines like paracetamol for fever and pain. But avoid aspirin or ibuprofen unless advised. These can cause bleeding in some mosquito-borne diseases. If symptoms get worse, like trouble breathing or severe dehydration, seek medical help fast. Can you actually stop chikungunya before it starts? Yes, by making life hard for the mosquitoes. Remember, they breed in clean, standing water. So simple actions help a lot. Cover water tanks, empty flower pots weekly, and throw away unused tires or bottles. Use mosquito nets while sleeping. Wear long clothes in the daytime, since these mosquitoes bite in the day, not night, and apply safe mosquito repellents. Some neighborhoods run cleanup drives. Imagine your whole street coming together to remove trash that holds water. Communities that do this see fewer cases. There's no widely available vaccine yet, but protecting yourself from bites is your best defense, like wearing a helmet when biking, just in case. Is science making progress? Definitely. Scientists are working on a vaccine. In 2023, one candidate vaccine called VLA1553 finished early trials and showed good results. It created strong protection with just one dose. It's not available for everyone yet, but it's a big step. Other researchers are testing ways to modify mosquitoes so they can't carry the virus, like giving them a natural shield. There are also new rapid tests being developed, so people in remote areas can know fast if it's chikungunya. These advances give hope that one day, we won't have to fear this painful disease anymore. especially for older adults